Welcome to SI UK Thailand webinar. Thank you for joining us today. We are now live with University of Sunderland. Today we have Deanne, John, and Chin with us from University of Sunderland. Over to you, Deanne.
Hello, everybody. What I'm going to do today is I'm going to talk about the Overseas Pharmacist Assessment Programme, which is also known as the AUSPAB. So this is a programme that you can complete if you are a qualified pharmacist outside the European Economic Area. And this allows you to join training to become a qualified pharmacist in the United Kingdom. So there's quite a few members of staff who are involved in the programme at the university, not just the three people here on the slide, but these are the three main people that you will see if you decide to join us at the University of Sunderland. John Sherwood is actually on the call as well today, so he'll chip in at some points in the presentation. You may be able to see him on his camera there. So my name's Deanne Marshall. I'm the programme leader for the AUSPAB. So you will probably see quite a lot of me if you come to join us at the university. And I'm also module leader on one of the modules you will complete, which is called MPHM 14, Clinical Therapeutics. So that's a picture of me there when I had much shorter hair. Also as well, we have John Sherwood, who is a module leader on MPHM 15, which is the Pharmacy Law and Ethics and Practice module. And John is on the call today. We also have Gemma Donovan as well, who is the MPHM 16 module leader. And she is the module leader for the MSc project, so the Masters project. So if you decide when you come and join us that you want to also do a Masters as part of your qualification, Gemma will be involved in that with you. So what is the AUSPAB? So if you have decided that you would like to come to the UK and become a qualified pharmacist, you would need to complete an AUSPAB programme. So we do offer this programme at the University of Sunderland, and it is a 1-year full-time programme. It is modular, so it has modules. It's split into 3 modules, and it is a postgraduate programme. Okay, you can either choose to do a diploma, which is the part of the programme that you require to enter into foundation year training with the General Pharmaceutical Council, or you can do, if you choose to, you can do a master's qualification, an MSc qualification, and this may be because you possibly need this qualification to allow you to get a working visa in the UK. The programme has lots of parts to it in the modules, and it has placements. So if you have no experience of working in the UK, you will be able to go out on placements to see the different sectors of pharmacy in the UK. So community pharmacies, hospital pharmacies, also primary care as well, which is working in doctors' surgeries or GP surgeries. You will also do a lot of experiential learning as well. So this is learning as part of the job really, and going out and experiencing and observing what we do as pharmacists once qualified. The course is very patient-centred, and we do have what we call expert patients work with us throughout the course. They're also known, you may hear this if you do come and study with us, known as PC Pies, which is quite a funny name. And they would be involved in patient sessions, so counselling and other things, and also in something called OSCEs, which I'll talk about in a second, which is one of the assessments we do as part of the course. We also do a lot of interprofessional learning. And these are events when we meet up with other students from other disciplines. So we have a medical school and a nursing school at the university. So we have joint teaching sessions with those, and these are based around patient scenarios. So you would work together as a group to look after a patient. We also are involved with the dentistry school, which is up in Newcastle, which is quite nearby. And we also have psychology students as well. So we can get involved in some mental health scenarios as well with those. So after you've completed your AUSPAB and passed that, you would then need to go on and do a 1-year foundation training year in practice. So this is a paid position, a job in a pharmacy, either hospital, community, or doctor's surgery possibly. And this is previously known as pre-registration training, which you may have heard of before. This is the structure to the programme, so I might ask John to chip in a second. Okay, so this is how the programme runs. So we would start the course in September, okay, when you join us, usually towards the middle, in the middle towards the end of the month, and you would start with the 2 diploma modules. So these are MPHM 14, which is my module. This is clinical therapeutics. So this module contains all of clinical information based on UK practice. So there's a series of lectures, seminars and sessions related to this that you will be involved with. And this is also, we integrate this with the science. So the background underpinning kind of the decisions we make and how we're going to treat patients in the UK. So this is quite a big module. We also talk about community pharmacy in this module as well, and we learn about selling over-the-counter medicines as well, because it is very, very different in the UK. I can promise you that. There's a lot of legislation, licensing and restrictions around that. So we'll teach you all about that as well. So it's quite a big module and kind of the clinical kind of underpinning of what you will be doing as a pharmacist in the UK. MPHM 15 is John's module, and I don't know whether John wants to chip in now and just tell us a little bit about that.
That's okay. Yes, thank you, Deanne. So I'm the module leader for MPHM 15, which is the module that runs alongside MPHM 14, and that's the module we're looking at pharmacy law, ethics and practice. So this module considers the law relevant to pharmacy in the UK, including obviously pieces of legislation that are specifically related to medicines, but we also consider legislation that is not particularly medicine related, but which does have an impact on pharmacy in how it's practiced in the UK. And this is primarily delivered through lectures, but we also try and put the law into practice in our dispensing sessions. We call these simulated pharmacy sessions, and you will have had a lecture about the law relating to the types of prescriptions that we're going to dispense beforehand, and then you get an opportunity to actually apply the law and what you've heard in the lectures to the prescriptions that you're dispensing in the practical classes. We also cover ethics as well. So we talk about how pharmacists make ethical decisions. And again, you'll get some experience of doing that, working through some practice scenarios in seminars. You'll work together as a group, discussing between the group all the different options that you might be able to do, and then come into a conclusion. And then you'll also present your findings to the group. So in that way, everybody can learn from that. There's also a section of the module on public health, and that again is delivered through lectures, but it's also delivered in seminars as well. And that gives you another opportunity to apply the information that you've learned in lectures to practical type scenarios. So I think you might look at the module title and think this is quite a dry module that's very sort of theoretical, but that's not how we teach it at the University of Sunderland. We teach it always with a focus on practice and what you need to know to be able to practice safely and legally as a pharmacist within the UK. We also have a strand on calculations as well. Now this is a strand that is sort of, we give you lots of examples on a regular basis of calculations, and that's primarily because I'm sure Deanne will probably cover this a bit later on about the General Pharmaceutical Council, the pre-registration exam. There's a calculations exam, and we want to prepare you for that exam right from when you start at the university, but we assume virtually no previous knowledge. We sort of take it from very basic conversion of units, from milligrams, grams, kilograms, etc., and then we move to what you might call more sort of focused pharmacy calculations about doses for children, doses perhaps based on renal function. We think about treatment durations and the number of tablets and capsules to supply to last for a particular duration as well. So again, that's taught throughout the module. Placements, Deanne's already mentioned about that, so they feature in the module as well, and you complete a reflective portfolio based on placements, based on the interprofessional learning sessions as well. So it's a big module, and they are 60 credit modules, but we know from feedback from previous students that these modules really set you up to start your pre-registration year, and also set you up to think about the pre-registration exam that you'll be doing at the end of the year, and obviously we do as much as we can to help you prepare for that. Thanks, Deanne.
No bother. Right, so these two modules run in semester 1 and semester 2. So semester 1 runs from September till December. We have a little break over Christmas time, and then we come back in January. That's semester 2, and that runs until Easter time, and so about April. And then after that, in May and June, we have the assessments, okay? Around about June time, if you have chosen to do the master's project, or you need to do that because of visa reasons, you would start that then. So the MPHM 16 is the research project module, which Gemma Donovan is the module leader for. She's not here today, unfortunately. So what happens in that module is Gemma gives you a lot of information, background about how to do research and different types of projects that you can do. So she'll give you the background knowledge to be able to obviously complete your research and to write up your project as well. And so you will be assigned a member of academic staff who will be your project supervisor, and you have some choice as to what topic you can cover in that. So obviously healthcare related, sometimes we do some educational projects as well around pharmacy education. So there's many different things you can do depending on what interests you have. Public health, for example, is another good one to do as well. So that project module runs from June until September. So if you're doing that project module, that is when you would do that and concentrate on that over the summer. Okay, so that's the structure of the course and how it runs. So a typical week on AUSPAB, we are full-time as in the hours we do, but we're only actually running 3 days a week. So this is Tuesday to Thursday. We've done this for a few years now, and this is to do with student feedback, as a lot of our students obviously are mature students, and some have young families, for example, and some, for example, are working as well. So we're able to pick up part-time hours. So we would only have you in usually Tuesday to Thursday during the week. Occasionally we are on a Monday or a Friday, usually for things like assessments. For interprofessional learning sessions, they may be on a Monday or a Friday, or you may be asked to go out to placements on a Monday or Friday. But most weeks you will be in, say, Tuesday to Thursday. The course is made up of a number of different elements. We have lectures. A lot of our large lectures now obviously are online because of the COVID-19 pandemic. And these are together with the whole AUSPAB cohort. And we have currently this year, we have 38 students doing the course at the moment. For some lectures as well, you will join up with the Level 4 Master of Pharmacy course as well. And these are for the clinical therapeutics lectures. So you will join them for their lectures as well. You have workshops, tutorials and seminar sessions as well. So these are usually on clinical therapeutics, over-the-counter medicines. We also do some public health sessions in John's module, and we do clinical skills as well in the MPHM14 module. Currently at the moment, these are in smaller group sizes because of the restrictions around COVID, and there's lots of restrictions put in place because of this, such as wearing PPE, and the university has put lots of things in place around this to have a safe environment for students to be able to come in. We have simulated pharmacy laboratory sessions, also known as dispensing, and these are 3 hours long, and you would have one of these usually once every other week. And obviously as well, you'll have a lot of self-directed study too as part of your course. This is just a rough outline of the timetable. So the Tuesday, Wednesday and Thursday. This is kind of what's happening at the moment because of COVID-19. So as you can see, we have a day of lectures on a Tuesday, some lectures on Wednesday, and a mixture between seminars and dispensing on the afternoon. So these will alternate for students. You'll not be in that entire 4 hours. Again, on the Thursday morning, we have some clinical skills or seminars going on, and these will alternate for students as well. And then on Thursday afternoon, we normally have a little summary of the week, just what we've done, what we've learned, are there any questions? And also as well, we introduce what's kind of going to happen next week and tell you what the plans are. Okay, so that's typically what we do every week. Obviously, as part of this course in the modules, you'll have some assessments to do. So you do have courseworks in the two main modules, MPHM14 and MPHM15. We do a mixture of things, including assignments and written reports, and we would ask you to write those up. We do have some multiple choice question tests every so often, just to check your knowledge and to check that you're understanding the work that we're covering. We do some presentations. These are done as groups, and they will be assessed. So on topics like things, public health and ethics as well. We do some poster presentations on some new novel drugs that have just come to market and the research behind that. John's mentioned previously that you do a portfolio, and this is linked in with what you have learnt while out on your placements. And obviously we do some exams as well, some examinations. So we do something called OSCEs, which is Observed Structured Clinical Examinations, in the MPHM14 module. These are probably quite different to what you've done in the past, or you may never have done them before. And these are practical exams where you will move around stations and react to scenarios that you were given. So for example, a patient coming into a pharmacy, community pharmacy, and asking for a product over the counter. How would you question them and how would you decide what to do? A clinical scenario that you need to go through, such as a prescription that's incorrect, and how you would discuss that with a doctor. Also, how to take a history from a patient correctly and thoroughly as well. So there's several different stations that you will be involved in there. Also how to counsel a patient, for example, on a medication, so a prescription-only medicine, as if you were handing it out over the counter. You will do some written exams at the end of module exams. So these will have a combination of styles of questions in them, such as multiple choice questions and also written questions. John's mentioned his numeracy. He will have an exam at the end of his module, and that will be obviously calculations questions. You will also have a simulated pharmacy dispensing exam where you will be given a series of prescriptions that you are expected to dispense correctly and legally, and also consider things like, are they clinically correct, are the doses correct, and other things as well. So quite a lot of assessments there on the modules. Obviously, as part of M16 as well, the MSc module, there's some assessments associated with that as well. Obviously, the main big one would be the handing in of the project for that module. So, if you come to Sunderland and join us, where will you study? Well, we are based on the city campus. So, we're based right in the centre of Sunderland, okay? And we have some lovely facilities which are very modern and have had some great updates over the last few years. We have a model pharmacy and some consultation rooms, so we were able to discuss cases with our expert patients. We also have some dispensaries or simulated pharmacy rooms and an OSCE suite, which allows us to do our assessments and also practice those as well. You may see in some of the pictures there, we have some wards, simulated wards on our facilities, and we have some really state-of-the-art scientific laboratories as well, with some really up-to-date equipment in there too. The university is very modern and has recently been vastly updated across the board. We also have a really good library, which is on hand. It's just over a very small road, so you can just walk there within a couple of minutes, which is very useful. And we also have some quite big lecture theatres as well on campus that we can use as well for lectures. So a couple of pictures there you can see are just one of our wards and our simulated pharmacy or dispensary. There's a couple of tours on here. I'm not going to go through them now, but if you would like the links, I'm sure they can be made available to you. And both these websites show you our fantastic facilities, so they'll give you a 360 view of our wards, our dispensary, and other rooms we have on the Science Complex. Also as well, the second link there is a virtual tour of the campus, so where we're based, and also a little bit background information about Sunderland as well, where we are in the northeast of England. We're on the coast, it's very nice. I personally was born in Sunderland and was brought up there, so obviously know quite a bit about Sunderland and obviously very close to my heart, living there most of my life. So, after all of that, that is the course. So how will you apply to the course is very important as well. So you do not apply directly to the university. You need to go through the General Pharmaceutical Council, which is our regulatory body for pharmacy in the UK. So this is the website here, and there's a lot of information on there which you need to go through and look at before you decide to make your application. There's a lot of stipulations of what documentation you need to hand in as well. Okay, so for example, as part of the entry requirements, you would need to verify your pharmacy qualification, and this is done through something called UK NARIC. So they would assess your qualification to see if it is suitable. You also have to have an English language competency as well. This can either be an IELTS or something called an OET. And all of the information that you need is on this website, okay? So your first port of call, probably, if you are thinking about doing AUSPAB, is to have a look here and see what you need to do, what paperwork and things like that. Once you've done that, and if you are assessed, and it's called an adjudication, if you're assessed and the GPHC say that you are suitable to enter an AUSPAB course in the UK, the GPHC will get in touch with the University of Sunderland. So they will send us your application. Once we receive that application, we will then get in touch directly with you and ask you to do a university application. As pharmacy is a registered healthcare profession in the UK, it's really important that you can practice safely and effectively with patients, okay? So as soon as you join the course, you are subject to fitness to practice procedures, okay? So this is all to do with your behaviour, obviously while you are at your course at the university and also in your everyday life, okay? So normally what would happen is you would, as part of your application, submit some extra documentation, such as a DBS check, which is a disclosure and barring service. And this is to do with checking your any previous criminal record. This is a UK-based check. So as you are coming from abroad, what you would need is actually a letter of good conduct from your local police authority. Also as well, you need to give a health declaration, and as part of that, you will be asked about things like vaccinations and other things. When you join us at the university as well, before you can go out on placement, you will be given an occupational health appointment as well at a local hospital, just to check your health and everything, and that you are suitable to go out on placement. When you're at the University of Sunderland, you do get a lot of support and help. We do understand, obviously, that you've come and travelled a long way and moved to a foreign country. And you do get a lot of support. You get a personal tutor, so a member of academic staff. You can contact directly if you need any help or advice, pastoral care. Also, if you need any references for employment as well. There's a large wellbeing team at the University of Sunderland, and this is based on the city campus, again, a couple of minute walk away at the Gateway, and they have a lot of student support services there to help you if you need anything. Accommodation you may be interested in as well, and the best place to look obviously is on this website here, and what is available to you if you do decide to come to the University of Sunderland. The university has a lot of clubs and societies available, so sports teams, for example, and other teams like crafts and hobbies. But we have our own society as well, the Sunderland Pharmaceutical Students Association. So this is a society that has social events and educational events as well. So, for example, they organise a pharmacy ball every year, which is a lovely event, which we haven't been able to have for the last couple of years, unfortunately. And we also do some educational events as well with them. So some calculations practice is a very popular event that they do. This is Paul Shambrooks on this picture here. He's a level 4 student currently, and he is pictured with Mr. Ravi Sharma. And he is actually director of the Royal Pharmaceutical Society of Great Britain, which is our professional body in the UK. They have a Facebook page if you're on social media, and you can have a look at that and see the kind of things that they actually do. And they've also got a website as well. They have lots of information on there. If you become a member, it's not very much. And they also do things like revision guides and OSCE guides and things like that, which are very, very popular with students. This is a picture of John Sherwood, who's on the call today, who talked to you earlier. And this is a picture of him at the pharmacy ball a few years ago with some of our lovely students. Okay, so having a good night then. We all get dressed up, put our best on, and have a lovely evening, a nice meal and dancing and things like that. So this is a lovely picture there of him. After you complete your training, your AUSPAB course, at the University of Sunderland, you need to do a foundation training year, okay, before you can become a fully qualified pharmacist in the UK. So you need to complete 1 year of training in a pharmacy sector under the guidance of a pharmacist tutor, okay? And you are paid for this. It's usually starting at around 18,000 UK pounds per year. That's your salary. This is a very intense year of training and also working as well. You have to be signed off against a lot of competencies. So these are behaviours that are expected of a pharmacist, okay? And you have to provide evidence for that do things like continuing professional development as part of that as well. You obviously have to revise as well as part of this and be ready to sit your registration assessment, which is set by the General Pharmaceutical Council. This is an assessment that is split into 2 papers. There is a calculation paper in the morning, that's 40 questions in over 2 hours, and the pass mark for that is 70%. You also have a second paper in the afternoon, and that is a clinical paper and also some law questions in there as well, and other questions. Okay, so you need to pass that as well, pass both papers, and if you do that, it enables you to be eligible to register as a UK pharmacist with the GPHC and join the Register of Pharmaceutical Chemists. So myself and John are both on there if you want to find us. So this is just a graph that shows you our performance over the last few years in the actual GPHC exam. Okay, so this follows our students once they've graduated from the University of Sunderland and how they perform in their GPHC registration exam. So these are our AUSPAB students. And as you can see, this was the last set of results we have for the 2019 June sitting. And this shows that the blue line in 2019, 90% of our students passed. We were actually the highest performing School of Pharmacy with an AUSPAB course in the UK in that sitting. So that's quite a good accolade to have, and shows that we do prepare our students well and to be able to pass that assessment and ultimately join the pharmacy register as a qualified pharmacist. It's very important, obviously, to mention this to you. So you need to apply for your foundation training year, and you actually need to do this before starting your course. Okay, it's your responsibility to find a foundation training year job placement. Okay, and unfortunately the applications for this actually start before you've even started your AUSPAB. So for example, if you were thinking on joining us in September this year to do your AUSPAB, you would need to start applying for your foundation training year placement in June. Okay, and I know this is before you would actually come to university, but it's very important that you do that. Oriel is a National Pharmacy Foundation Training Recruitment Scheme, and they open their applications in June, the year before you wish to start your training. The deadlines are very strict, and they do not have a late application window. So therefore, it's very important that you need to do this before you come to university in September, as this is where the vast majority of placements are put in the National Recruitment Scheme. Some pharmacies do offer their foundation training year placements outside of this scheme, but there are not as many placements available. So to give yourself the best chance, and also all of the NHS hospital foundation training year placements are placed inside the Oriel scheme. So it's very important that you do this before starting your course. And more information on this can be found on the website there. The applications aren't open at the moment yet, so they should be opening up June. So that website will be updated with that information. Obviously, once you're qualified, you have lots of career options in the UK. So the two main ones there that most people go into are community pharmacist. So working in a community pharmacy, either a small chain or individual pharmacy, or working for one of the larger pharmacy chains in the UK, such as Boots, the Chemist, Lloyd's Pharmacy, for example. They're really big chains over here. Hospital pharmacy is also an option as well for you. So working within any of the NHS trusts we have across the UK, there are a lot of hospital pharmacists in the UK, and that is a very popular career choice as well. Primary care pharmacists are relatively new. Although we have had some pharmacists doing this for quite a long time. I know John personally works in a GP surgery, and this is becoming now another option to do foundation year training as well. And also quite a lot of pharmacists now are actually going and working in primary care or doctor's surgeries. Some of our students, a few but not very many, do go into industrial pharmacy. So working in drug production. We have had some students in the past who have gone into this sector. You could also become one of us, so an academic or a research career if that is what you enjoy. So there's many posts available that you could possibly go into in the future as a pharmacist. Also as well, there's always other options. It's a very there's lots of things you could possibly do with a pharmacy qualification in the UK and being on the register. You could go and work in the government and work on policy, work for the GPHC, for example. Some pharmacists work in journalism and in producing journals, and also in newspaper journalism as well. And there's lots of scientific related employment as well. So there's many different things you can do with a pharmacy qualification, being registered in the UK. And obviously we aim to prepare you kind of to enter any one of these sectors after registration. So that's why our course is quite diverse. There's lots of different sections to it. We cover science as well as obviously the clinical and the legal side of things as well. This is just an example of one of our previous students. So this is Cozy, and she was my master's student a couple of years ago now. And she came to do AUSPAB at the University of Sunderland. She's from Nigeria originally, and she wanted to come and live in the UK and work as a pharmacist. So she came to one of our open days and had a lovely welcome from us. She enjoyed her time with us at the university, so she found the modules interesting, enjoyed going out on her placements, and what she plans in the future, she plans to work in hospital pharmacy. So she went to do her pre-registration training down south, and is aiming to get her some work in hospital pharmacy. She also did a master's project as well with me and did really well in that. So she's just an example of one of our previous students and a case study of that. So, right, so that's the information I have for you today. Obviously, I think we're going to open to questions in a moment. If you've got any questions as well, if you don't want to ask now, if you want to get in touch with me personally, if you drop me an email, that's my email address there, and I'm the program leader. If you've got any queries about visas, for example, the best people to ask is the international office, okay, and that's their email address there. The program website's also there for any information, just a general overview of the courses on there. There's information about fees and other information, and also links to other information sources from the university. So that's me done. So are we opening up to questions now?
Hi, I'm Nikki from Thailand, SIUK Thailand.
Hello.
Hello, can you hear me?
Yes, I can, yes.
Yeah, I have some question, a few questions from the YouTube live stream. So they want to know about IELTS score requirement.
The IELTS score, it's 7. They have to get 7, and they have to get 7 in all 4 categories.
Okay. And what about the situation for COVID-19 in the UK now?
What do you mean?
Is it ongoing now?
All right. How are we? how are we doing?
Yes.
Yes. I'll be gentle with this. We're doing quite well at the moment, aren't we, John?
We are, yes.
We are.
The vaccination program.
Our vaccination program is going extremely well. We have more than half the population vaccinated. I think we're currently up to about 32 million of our population have had at least their first dose of the vaccination. I think it's about 4 or 5 million have had their second doses as well.
Okay.
Our cases are right down, and our deaths are right down as well. So we're doing very well at the moment in time. We're currently still in lockdown, but we're taking a very cautious approach at the moment. Our government have they're taking things slowly this year after what happened last year, I think, and they've learnt a lot, and we're slowly opening up again. So we're taking things slowly, but we are doing very well at the moment.
Okay. Yeah, I understand. A few questions about the course. So what careers that the student can choose after competing by biopharmaceutical science? Biopharmaceutical science.
We only do the AUSPAB, obviously, masters. There are other masters available in science, but we don't deal with that one. The one we mainly do is to obviously help students get onto the register of pharmacists here in the UK. There are other scientific masters available if they wanted to do those, but obviously they would not lead into them being able to go onto the pharmacy register.
Okay. So what are the career opportunity or the for pharmacy doing the course, like internships, student available to do that?
Well, there are the students who do our course, the vast majority of them, 90% plus, if not all of them, actually get training positions after they've completed the course. And obviously once they're qualified as a registered pharmacist in the UK, they shouldn't have issues with gaining employment, as there are a lot of pharmacy jobs available. They may just have to be a bit more flexible about where they work. So there are some areas that have more jobs available in the UK than others, but there's always employment out there.
Yeah. Okay. So once a question they ask, can I apply for clinical pharmacy MSc course without any work experience?
Any experience in pharmacy, do they mean? We do have some students who have just completed their undergraduate degree, for example, who in their home country, who do come straight over and do AUSPAB and their MSc, yes.
Okay. I think this is all of the question the student want to know.
Okay. Well, if they want to contact me, obviously, my details are there. There's also the information about the tours and things like that. So if they wanted to look at those on the website, they're quite good as well, showing them the facilities and things like that. If I can't personally answer any questions as well, if they do email me, I'll be able to obviously forward it on to anybody who can answer, such as like visa queries and things like that. Okay.
Thank you so much.
Thank you.
Thank you.
I hope you have a good day and stay safe.
Yes. Is that us done then?
No. Okay. Thank you so much.
Thank you. Bye.